Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 homeopathic remedies for Agalactia. Mind, the pronunciation is not Agalactia but Agalactia. Actual pronunciation is Agalactia. What is Agalactia? The state of women suffering from complete absence of breast milk after giving birth to a child is known as Agalactia. Mind this, that this is a very extreme situation for a lady, and this is if it can be attended properly, the lady will bless the doctor. What are the causes of Agalactia? Most common causes of Agalactia are absence or insufficient glandular tissue in the breast, actually, violation of prolactin secretion, genetic predisposition, taking medications, feverish state, diseases accompanied by hyperthermia are common causes of hypogalactia. Hypogalactia actually means less amount of secretion of breast milk. And external factor. External factors, there are so many diseases, poisonous things, etc. I will be discussed later on. How cases of Agalactia are managed? Primary Agalactia is completely incurable. Cases of secondary Agalactia are manageable depending on situations. Removal of cause behind the problem, lactation depression, like acute infection, poisoning, stress factors, this should be removed first. Then homeopathic medication after proper consideration of totality of the case. Now, totality of the case means the person, that is the patient, that is the lady, his father side, mother sides, total history is required. His personal history, or her father, mother side, and her personal history, her sisters, maybe junior or senior, all histories, all types of ladies cases are to be incorporated in this case particular. This is called totality of the case. Then only the doctor can feel what is the problem behind the total problem. What is the acute, actually, exciting or rather activating cause of this disease. This is to be determined by the doctor through consideration of the totality of the case. The totality of the case is a very serious thing in homeopathy. General management of health also is required. General management I will be discussing later on. It will be coming just below. How Agalactia can be prevented? Girls, ladies should avoid medicines having degenerative effect on mammary tissue from as early as possible. This is a very difficult thing, because unless the guardian of the girl or lady is serious, it is not preventable. It cannot be prevented, because the girl or lady may suffer from some disease for which medicine has been selected is dangerous for her breast tissue. It is quite possible, but who knows and who will think in that level. But if the guardian is sufficiently conscious about allopathic medicines, he can directly ask the doctors whether this medicine will endanger in some way or other my daughter's other components of body, say ovary, breast, etc. If this question is asked by guardian, the doctor will think, yes, this is a man, a sensible man who is very much conscious of the present medicinal world, because there are so many medicines in allopathic which endanger health of everybody in different manner, particularly ladies, because in case of ladies there are so many sensitive cells, very much sensitive cells, ovary cells, very much sensitive cell. These cells of this breast, they are also sensitive cells. So this is to be guarded against from the very early life of a particular girl by guardian. They must quit all sorts of addiction. This is something to be done by the lady himself. Eat balanced diet, maintain healthy body weight, take regular physical exercises, undertake medical checkup at least once a year, and severe stress, poisoning and radiation exposure must be avoided. These are also causes of Agalactia. Severe stress, poisoning and radiation. These are to be avoided totally. Discussions about treatment for Agalactia with homeopathic remedies. Agnes Castas for Agalactia. Patients suffer from despairing sadness. Breast milk scanty or disappears. Patients busy finding solitary place to perform masturbation. Now you may wonder, what is the relation between masturbation and Agalactia? No, there is no relation. This is for selection of the Agnes Castas. Agnes Castas patient will do this. He will try to find out solitary place for masturbation. There is a normal thing. Every one of us very often does it. Asapitida for Agalactia. Breast oversensitive, milk deficient. If it flows, it is offensive to baby. The baby will not take the nipple in the mouth. He will just remove her mouth from the nipple. Veins over breast unnaturally distended. Bluish veins can be visible over the breast. Sickle core for Agalactia. Thin, scrawny women. Look at the picture on the right hand side. Scrawny women. Breasts do not properly fill with milk. Stinging pain in breasts. Puerperal mania exposes organ. That is, out of mania, she exposes her organ. This is maniatic phase. It is also quite natural and normal. Mercurius for Agalactia. Milk scanty. Comes scorbutic. Glands swollen. Positilla for Agalactia. Mammy swollen and painful. Patients gloomy and tearful. Look at the picture on the right hand side. Milk scanty or absent. Causticum for Agalactia. Dysmenorrhea with tearing pain in back and thighs. Anxiety, sadness and weakness. Milk absent. Lactiflor for Agalactia. Breasts diminish in size. Secretion of milk nearly stops. Fully exhausted feeling whether she does anything or not. Lactiflor is so severely weak that without doing anything, she is fully exhausted. This is the peculiarity of weakness of Lactiflor. Fully exhausted feeling whether she does anything or not. Rastux for Agalactia. Entire want of appetite. Mental derangement and thoughts of suicide. Loss of power in lower extremities. Now you may wonder how Agalactia for Agalactia Rastux will be selected. The particular patient of Agalactia will have this type of symptoms. She will have no want for any food. Her mental derangement is there and she is thinking of committing suicide all the time. Maybe there is agalactia, but this will be there also if Rastox is there. Loss of power in lower extremities. The Rastox patient, lower extremities are generally very weak. They cannot walk properly, they cannot run properly. With this, the video ends. Thanks for listening, viewing. Any problem, write it in the comment section. I would certainly attend.